and welcome to the Winnebago County Health Department TV show, where we talk about public health issues and relate them to your health. I'm Alana Erickson. Today I have a guest with me here from the Health Department. Go ahead and introduce yourself and your title.
My name is Carolyn McCarty, and I'm the Community Health and Prevention Supervisor at the Winnebago County Health Department.
Thanks for being here. So today we're going to talk about health improvement plans. First, can you explain what a health improvement plan is, why we need one?
Sure. So a health improvement plan is sort of kind of a guidebook, a way for people and organizations who want to impact health, a way for them to know what to work on, what are the priorities in that area, and how to do that. What are some good ways to have a good impact on that priority?
Okay, so you talk about impacting things. What are these health factors that play a role in the health plan?
Yeah, so our health is impacted by a lot of things. We've learned a lot about what impacts our health in recent years. Traditionally, we thought of health behaviors, and that if we wanted to impact health, we needed to just teach people how to do healthier things. And what we've learned is that that's important, that that's a piece of the puzzle, but it's a much smaller piece than we thought, and that things like the physical environment and social context have a big impact on our health. And that we need to work at that higher level in order to have a more sustainable impact on a larger percent of the population.
So the state of Wisconsin just released their health improvement plan. What are their major focus areas? What are they working on?
Yeah, so the state has a health improvement plan that they do every few years. And in this version that they just released about a month ago, they've identified 5 priority health areas to work on. The first of those is opioids, also tobacco, alcohol, suicide, and nutrition and physical activity.
Okay, so out of those priorities, do any of them relate to Winnebago County's health improvement plan?
Yeah, so when we saw the state health improvement plan come out, we were kind of excited to see that it aligns really well with the priorities that we've identified for our health department and for our community. So there's the state health improvement plan, and then there's also a community health improvement plan that we develop at the local level. And just recently, it hasn't totally been released yet, but we've identified the priorities for our what we call CHIP, Community Health Improvement Plan. And those include social and place connectedness, opportunities that improve health, mental health, alcohol and other drugs, and healthy foods and beverages.
Okay.
And then within the health department, we have our Community Health and Prevention Division, which is the area in which I work. And we have focus areas that we work on. And these align almost perfectly with the State Health Improvement Plan priorities. And so we work in the area of substance use, which includes alcohol and opioids and tobacco. We also work in mental health, healthy food systems and nutrition, and active communities. So you can see there's really clear alignment across these 3 pieces.
Yeah, they're very intertwined, but I'm curious, what's the difference? How did we come up with our priorities? Why didn't we just take the priorities from the state list?
Yeah, so the state identifies the big issues that go on across the state, but what we care most about are the issues impacting our local community. So our Community Health Improvement Plan, the process for developing that allows us to identify the issues that are most pertinent in our local area and how we can work on those in the ways that will impact our local people the most. And then that health improvement plan is for more than just the health department. That's for the whole community to know what can we be working on to impact health in our county. And then our health department identifies what are we specifically working on as a health department, and that's where those 4 focus areas of the Community Health and Prevention Division come in. And they're guided a lot by the CHIP, also by the state and national priorities, and then what we hear from partners and other factors like that.
All right, so it's a community conversation that really decides what's local to Winnebago County.
That's right. There's data. We use some hard numbers, some surveys and data, and then we have conversations with key community members and community partners to help identify those issues.
Good. Well, it's nice to see that this process works from the bottom up and the top down. It seems like, we made a nice mix of what the locals need and what the state wants us to be working on as the health department. Let's dive into some of the priorities and kind of give folks at home an example of what that actually looks like. So you mentioned one of the state priorities being suicide prevention. And how does that coincide with the efforts at Winnebago County?
Yeah, so suicide prevention is a priority within our areas of mental health, which is a focus of both the Community Health Improvement Plan and our Community Health and Prevention Division within the county. And another piece within the Community Health Improvement Plan that really will impact suicide prevention is the social and place connectedness piece that I mentioned.
Great. Another one we were talking about was the opioid, alcohol, and tobacco use. When we're in Winnebago County, what are we focusing on?
Yeah, so we have exciting work in each of those areas. Some of those are growing issues. Some of those are issues that we've seen for a long period of time, and we've been working hard to impact them for a while. One of the growing issues, emerging issues that we're seeing is the opioids, like you mentioned. And we have a relatively new coalition in Winnebago County called the Winnebago County Drug and Alcohol Coalition that is really where the health department is putting our energy in terms of impacting opioid use and reducing harm and death from opioid use. And that previously was called the Heroin Task Force. Just this past year changed its name to the Drug and Alcohol Coalition. So that's really where the efforts are at, and they work in prevention and awareness, treatment and recovery, communications, and data. So that's where the work for opioids is at. Our Rethink, the Winnebago County's Healthy Living Coalition, has an alcohol team that is working on changing the alcohol culture and reducing binge drinking. So they just went through a planning process, and this year, focusing this summer really and through into the fall, focusing efforts on understanding the alcohol culture, particularly at festivals and events, and then hopefully having an impact on reducing binge drinking in those atmospheres and those sorts of things.
All right. And Leslie, let's talk about some of the nutrition and physical activity examples in Winnebago County.
Yeah, so that again is work we've been doing for a long time, but we have some new initiatives that we've been working on that are really interesting and innovative. In the nutrition and food systems work, we have a partnership with our retail outlets, our restaurants, that tries to encourage children to make healthy food choices while they're eating out. So that's called Kids Live Well, and it's part of kind of a national initiative, but we've brought it here to the local level and have been working with restaurants to have that implemented there.
Great. Well, it looks like you guys are doing a lot of work. You know, and it's obvious that the health department can't take it all on. You know, what partners are you pulling in? What's the health department's role in making sure this health improvement plan goes through?
Yeah, so we really see our role as kind of leading the strategy around this and pulling in partners and hearing from the community and initiating change through those partnerships.
Great. And when 2020 gets here, we do it all over again?
We do. We go back to the community, we learn what's new, what's going on, where we need to continue to work, and we keep pushing forward to make our community a healthier place.
Great. Well, thanks for being on. You can find more information about Winnebago County's Health Improvement Plan on our website, www.winnebagopublichealth.org, and follow our updates about how you can get engaged on our social media at Winnebago Health.
Prenatal care coordination is a free benefit of medical assistance. So a nurse can guide and support a pregnant woman through her pregnancy and on the things that she finds that's important to her. So a lot of what we do is support, referral to community resources, and then we do a lot of education. So education on pregnancy, on labor and birth, parenting, infant care, the emotional aspects of pregnancy, breastfeeding, all sorts of different kind of things, and really dependent on what the mom wants to learn. A typical PNCC visit, they come into the office with me, and then we talk about something related to their pregnancy, and usually I'm just trying to find out what's going on. Do they have enough food in the house? Are the living situations okay? All that kind of stuff. And then as far as education, dependent on where they are in their pregnancy. So it's really guided by what mom wants to do. pregnancy services is offered to any pregnant woman who has Badger care or medical assistance. Although folks who are on WIC or another pregnant woman in the community also can have prenatal services through us as well. It's best for a woman to sign up as early as possible, because then we can talk about kind of those really early things about how important prenatal care is and how important quitting smoking is, and trying to catch those things real early in pregnancy and make sure that as the pregnancy progresses that we're covering all the topics and making sure that she's totally ready for that baby to come when it's time. But then again, on the other hand, it's never too late to sign up either. We get referrals from all different places. We get referrals from the doctor's office, we get referrals from WIC, we receive referrals from the HMOs as part of their Badger care. The women can self-refer, so we usually get referrals, and then we would approach the women and tell them what PNCC is and find out if they're interested. We have a grant through the Department of Transportation that provides car seats, so then we're able to help them get an infant car seat if they need one. We also have the Safe Sleep program, so we're able to do pack and play if they don't have any other place for baby to sleep. So overall, I would say it's an educational program that provides support to pregnant women throughout their pregnancy, and then also to make sure that they're hooked up with all the referrals in the community that can help them have a healthy baby.
Welcome back. My name is Alana Erickson, and today we have a guest here, Sarah, that's going to introduce herself and talk about her position.
Sure, thanks. So my name is Sarah, and I work at Nova Counseling Services, which is a 50-bed residential inpatient unit for adult men and women with substance abuse problems. And I also am the chair of the Winnebago County Drug and Alcohol Coalition.
All right, and I asked you on the show today to talk a little bit about an upcoming event. What is it?
Yeah, it's the Rethink Addiction Run.
Okay.
And so the run will take place on September 9th. And we're just rearing up for that, getting our sponsors in aligned. People are starting to really sign up.
And this is a run, a walk?
Yes, so there's 3 different distances this year. There's a 1-mile run or walk, there's a 5-mile run or walk, and then there's a 7-mile run or walk.
Okay. This is a fundraiser, correct?
Yes. So the proceeds from the event last year were split up into 4 areas. One was the Nova Counseling Angel Scholarship Fund, or Nova Counseling Services for clients, and then the DARE program, and then Solutions Recovery Club also got some funds. We were also able to add a new person to help with funds, is the Wisconsin We Can Change Addiction Now program in this area.
Okay, so who runs this? I mean, how long has it been going on?
So the Heroin Task Force, which is now the Winnebago County Drug and Alcohol Coalition, when we first started meeting, the prevention pillar was one of the committees, and I was on that pillar, and we wanted to raise awareness and funds in the area. So really the run spawned kind of out of that pillar.
All right, and this is your 4th year doing it?
Correct. Yeah.
Where is it hosted? Where does it take place?
Yeah, so it starts and ends at Solutions Recovery Club, which is on the corner of Parkway and Evans. And it goes through Menominee Park and just comes right back there both starts and ends there.
So you run along the lake?
Yeah.
Sounds like fun.
Through the park, yeah.
Do you have to be, is it for all levels?
Oh, yeah.
So is it a competition? Is it timed?
It is timed. Okay. So we do have awards, and we'll give out prizes, and there's also a silent auction and all that kind of thing, and like an open house. But a lot of families are walking or running to honor their loved ones that they may have that are in recovery, or that they may have lost because of the disease of addiction in their family. So.
Wow. Is it a big, how many people are coming to this event?
Last year we had over 800. So this year we are hoping for, 1,000 people, which is exciting.
That's great. How much did you raise last year?
Last year we raised approximately $23,000.
Great.
So we were able to help a lot of people with that money.
So if someone wants to sign up, where do they go?
So they would go to dotryrun.com, and you can click on the Rethink Addiction Run link, or you can mail in any of these registration cards that we have to P.O. Box 631 in Oshkosh, Wisconsin, 54901. And they're placed throughout the community at the YMCAs and at local businesses. And otherwise, you can always contact me at Nova, and I can provide you with a rack card so you can sign up.
Sure. Yeah, I know that we put some up at the health department. We've also been advertising it on our social media and websites, so feel free to go there if you want more information on it. What if you're not a runner? Can you still participate?
You can. I think there's the majority, a large amount of people do walk. Mm-hmm. It's a walk run, and it's really just kind of a fun family-filled event too, and for people to like celebrate recovery, and you have speakers, and it's just there's vendors, like people giving you information about their programs and things like that, so it's pretty neat.
Great. If you want to volunteer for the event, you can call the Winnebago Health Department and ask for Stephanie Gildenvan. She'll set you up with that. And just as a recap, the race is coming up on September 9th, and that's a run walk to raise funds for addiction services in Winnebago County.
Bats become more active in late summer. Baby bats are born in June and start learning to fly in July and August. Bats mate in September and start seeking hibernation sites in October. You should always protect yourself by wearing a thick coat with long sleeves and gloves. Picking up a bat without gloves endangers you and the bat. If you have to catch a bat in your home, wait for the bat to land, then cover the bat with a box. Slide a sturdy piece of cardboard between the box and the wall slowly, allowing the bat to detach from the wall and enter the box. If you must kill the bat, do not sever the head from the body. If the head is not attached or the neck and nervous system have been damaged, the state lab cannot accurately test for rabies, and you and your family may have to undergo rabies treatment. It is crucial when trying to remove a bat or to capture a bat in your home that you do not have any contact with that, because that would be considered a bat exposure. If the bat has bitten any person or pet in your home, or the bat was in a room with unsupervised children or pets, you can take it to a veterinarian to be euthanized. The bat must be sent to the state lab for rabies testing. If you, your family, or your pets have had a bat exposure, you can bring the dead bat directly to the Winnebago County Health Department, and they will send it to the state lab for testing. If you are unsure if your encounter with a bat constitutes a bat exposure that would require rabies testing, please call the health department at 920-232-3000. To dispose of the bat, it must be in a durable container like a Tupperware or a laundry detergent bottle, something that its claws can't get through. Put the container in its own garbage bag and then dispose of it in your normal garbage bin. We do not recommend plastic bags or garbage bags because the bat's claws can cut through thin material. The Winnebago County Health Department does not go to homes and remove bats. To learn more about bats and the proper removal of them from your home, go to the Wisconsin DNR website.
Welcome back. My name is Alana Erickson, and this is the Winnebago County TV show where we talk about public health issues and relate them to your health. Today I have a guest from UWO and the health department, and I'll let them go ahead and introduce themselves and your title, your role.
My name is Carmen Thiel. I'm the lab manager for the UW Oshkosh Environmental Research and Innovation Center. We're a water testing lab. We also do other testing such as surface water testing, recreational water testing such as beaches, compost testing, solids testing, you name it.
You do it all.
Yes.
All right.
And I'm Doug Guerin, the Director and Health Officer for Winnebago County Health Department.
All right. So my first question, Doug, when it comes to recreational water, the health department's always advising wear your life jackets and boat safety, but something we don't always think about is water testing. Why do we test? Why is it important?
Sure. Well, I mean, water is one of our greatest community assets, especially here in Winnebago County. We're certainly a recreational draw, and we have lots of residents that use the water. And so if we can help the community know what those conditions are or identify when there's adverse conditions, we can help keep people healthier.
Great. And you guys do the testing, correct?
Yeah, so we employ 5 full-time research scientists. They're full-time staff, and we also employ over 50 students per year. It's not only at the lab, but all over the state. We have students working in Vilas County, Manitowoc County, Door County, Winnebago County, and primarily what they do is surface water testing, as in beach testing for E. coli, and we also do some drinking water testing as well.
So when you guys are doing the testing in Winnebago County, what are some common things that come up?
What we monitor is for E. coli. So E. coli is a fecal coliform or bacteria that can get into the water from basically fecal matter, whether it's from humans, animals such as birds, cows. That's a lot of the time, that's the source of E. coli in beaches. So we routinely sample the Wisconsin beaches. In Winnebago County, we monitored 12 beaches and boat landings. So that's what we routinely weekly sample for. In addition, some other things that would be an issue in surface water would be cyanobacteria, which is commonly known as blue-green algae, but it is actually a cyanobacteria. And so these cyanobacteria can produce a toxin that can be a hazard to animals and human health. And not all cyanobacteria produces toxins. So basically what I recommend people to watch out for is just watch out for stagnant water. If there's a lot of fecal matter on the beach. And yeah, if there's no wind, watch out for that as well as discharge pipes. That can be a big source of.
So you guys go to the different beaches in Winnebago, and when you find tests that aren't so favorable, what happens next? Who do you tell? What are the steps?
Sure. So these students that go out and monitor these beaches, if there are some numbers that come out high, we either post an advisory or a closing, depending on the level of bacteria. And so we post either one of 3 signs. It would be a green sign, as in the beach is open and it's good water quality. Yellow is an advisory, and red is a closing. So if you were to see a yellow or red sign, it would mean stay out.
All right. And Doug, do we put the information on our website?
Yep. So you can just go to WinnebagoPublicHealth.org, look up environmental health, and you'll be able to see the most recent samples posted on our website. And you can also look at all the historical results to get an idea of what the trend has been over the season.
Okay. So with E. coli and blue-green algae, is that something that you see or you smell?
E. coli you actually cannot smell or see in the water. Cyanobacteria, you may be able to see it, and it does also break down over time, so you may be able to smell it as well. In terms of cyanobacteria, what I would watch out for is kind of like a pea soup look in the water. Otherwise, if you see any floating scum-like material, that could also be a sign of cyanobacteria. But in terms of E. coli, you can't really see it or smell it.
And some of the messaging that we've given as a health department, besides like stay out, maybe that just isn't as well known. Can you talk about that, Doug? Boating or pets, that kind of thing.
Yep. So the blue-green algae or cyanobacteria, can be found throughout the lake. Wind conditions can push it from one shore to another. It can form really thick mats. It can be in one place one day and in another place another. So you really have to be aware of what the conditions are where you're at. We certainly advise people to stay out, as we mentioned, and to watch out for it when you're boating. If you're jet skiing, if you're boating, you can actually aerosolize the cyanobacteria, and it can be an irritant as well. So you really want to avoid the contact as much as possible.
Okay. Pets. We sometimes forget that the Fido runs into the beach. What are some messaging points there?
Yeah. So one of the I think probably the things that people don't take into account is that pets clean themselves, and if they are let to run loose and they run into contaminated waters and they clean themselves, they become quite ill. Same thing, young children, they don't understand the hazards, and so making sure they stay out of the water. Typically, wading into an area of cyanobacteria may or may not cause a skin reaction. We advise people to stay out, but kids especially, you really don't want to ingest any of that water.
Okay. Any other considerations on testing lakes or ponds that you want the public to know? Otherwise, we'll move on to pools, another public swimming area that people can enter. Are they tested? When are they tested?
Yep, so the Winnebago County Health Department tests all public pools, hot tubs. So these are public pools, schools, condos, hotels, motels, and those are all tested a minimum of once a year. And we're looking at water chemistry. We're looking to make sure that pool is maintained properly, looking at pool logs, looking for safety features, just to make sure that those areas are safe.
Is it the same type of things that they're looking for, E. coli and blue-green algae? I mean, what are people looking for?
Yep.
What are we testing for?
So in a pool, we're looking at water chemistry. We want to, with efficient chemistry, you have good disinfection. So are the chlorine levels there? Is the pH right for those chemicals to be working right? We're looking for clarity in the water. So one thing you can look for when you go to a pool, you can't test it for chemistry yourself usually. Is it clear? And is there a really strong chlorine smell? Typically, you have a stronger smell when you have chloramines produced, which is a result of that chlorine working. And so high loads, high participant loads in pools is another indication of potential water quality impact, and maybe something you want to consider before you use the pool.
Mm-hmm. So if people have concerns about a pool and aren't sure if it's tested, who should they contact?
Mm-hmm. So typically, every site's going to have a pool operator or manager. That would be the first person to contact if you have questions about the pool, and especially if you see conditions at the pool immediately. Things that might be a hazard, like broken glass, or a child's diaper that might happen to fall off, or the notorious fecal incident that usually causes a mass evacuation of the pool.
Right, always keep your eyes out for those types of things. So the CDC has a lot of good resources that you can post at your facility about educational tools for swim safety, recreational safety as well. You can also go on to Wisconsin's website, the Wisconsin Department of Health Services website, and they've got a lot of information for you there as well. So our website is www.winnebagopublichealth.org. We also post information on our social media at Winnebago Health. So I want to thank my guests for coming in today. We got through a lot of information, but I'm sure if folks have questions, they can still reach you. How do they reach the Eric Lab?
They could come to our website. It's eric.uwosh.edu.
All right.
Or just feel free to give us a call. Again, our phone number is on our website. So
Great. Thank you both, and we'll see you next time. This has been the Winnebago County Health Department's TV show, where we talk about public health and we relate it to your health.